Hi, everyone. I want to thank you for being here today. My name is Justice Tosh, and I'm the lead informaticist here at Sunnyland Medical Center. Today, I will discuss a critical issue within our facility regarding fall risk screening and inefficiencies within the provider efficiency report. As an accountable care organization, we must meet specific regulatory criteria to maintain compliance and patient safety. The Journal of Health Services and Research states ACOs work to achieve the quadruple aim goals of improving patient experience of care, enhancing population health outcomes, reducing the per capita cost of healthcare, and ensuring positive provider experiences. Throughout this presentation, we will evaluate our current situation, identify issues within the current workflow, and assess viable solutions to improve compliance and patient care. To identify why and where the fall risk screening is being missed, first we must evaluate the current workflow of Sunnyland Medical Center. Stakeholders involved in the daily workflow include the patient, receptionists, nurses, and providers. The current workflow follows the following steps. First, the patient checks into the facility with the receptionist. Next, a nurse takes the patient to an exam room to collect data. The nurse identifies the reason for visit, assesses patient vital signs and medications, and performs intake screening. These questionnaires include learning style, social determinants of health, lifestyle depression screening, smoking. The nurse then enters their note into a secure workstation. After the nursing visit, the provider enters the room and the reviews the nursing documentation, assesses the patient, and places any necessary provider orders. Last, the provider enters the provider note, which includes fall risk, into a secure workstation. The nurse follows out any orders from the provider, and the patient is then escorted back to registration where the patient checks out and leaves the facility. Key takeaways from the current workflow at Sunnyland Medical Center include the nurse completes all intake documents and screening, and the provider documents fall risk in the provider note. However, there is no point within the current workflow where the fall risk screening is completed. Now that the workflow has been analyzed, we will analyze the data to identify areas of breakdown further. Between January 1st, 2020 and July 31st, 2020, there were 6,740 patient visits. 3 tasks were noted with 100% completion. The reason for visit, vital signs, and medication review. Other questionnaires completed include the learning style at 77%, smoking questionnaire at 99%, depression screening, at 67%, the fall risk at 0%, lifestyle questionnaire at 68%, and social determinants of health at 46%. The primary concern within the dataset is the 0% completion rate of the fall risk screening. This puts the facility at risk for noncompliance with ACO regulations and put patients at risk for falls, compromising patient safety. An article from Clinics in Geriatric Medicine states, falls result in significant physical and economic burden to patients, leading to increased injury and mortality rates and decreased quality of life, as well as to medical organizations, including increased lengths of stay, medical care costs, and litigation. Therefore, we must address this issue within Sunnyland Medical Center. To define the core issue, we must first compare the current workflow assessment with the data findings from the provider efficiency report. The current workflow shows no clear step for the fall risk to be completed, while the data from the provider efficiency report shows the fall risk questionnaire at 0% completion rate. These issues could be caused by several reasons, including the fall risk is not being completed by nurses, it's not being documented, or the fall risk screening is not being documented appropriately for it to register into the provider report. This could be from a lack of training or awareness, non-structured documentation formats, or even technical issues. From the findings of the workflow analysis and the provider efficiency report data, it is evident that the issue is the fall risk screening is not being completed or documented correctly to register it into the provider efficiency report. The provider efficiency report data backs the issue, displaying a 0% completion in this category, and the workflow analysis backs the problem, displaying no area where fall screening is being completed. It is critical to address this issue because it puts the facility at risk for noncompliance with ACO quality measures and can negatively impact patient safety. To ensure fall risk screening gap is addressed, a solution must be developed that ensures compliance and patient safety while not disrupting workflow or causing additional inefficiencies. The first potential solution that could be utilized to address the issue would be integrating a fall risk screening into the nursing intake portion. With this solution, the nurse would complete the fall risk screening in their initial intake and document into the nursing note. When the nursing note is achieved without the fall risk assessment, a hard stop will occur to ensure that this is completed before moving on to the provider visit. Nursing staff will be trained on the importance of fall risk screening, how to complete it, and how to document it properly. Implementing the fall risk screening in the nursing intake section would ensure the completion of tasks and standardized documentation, ensuring that the data is reliable. Hard stops incorporated into this implementation would ensure that the screening is not missed and will improve patient safety to reduce risk of falls. However, some staff may be more resistant to the implementation due to workflow disruptions, adjustments, and increased workload for the nurses. The next solution that could be implemented to address the critical gap in fall risk screening is a pre-visit patient questionnaire. The implementation would require patients to complete a digital fall screening before their visit via patient portal or check-in using a kiosk system. If unable to utilize the digital form, a paper formatted form can be filled out at check-in. Registration will enter the paper screenings into the electronic health record. The digital screenings will then automatically be generated into the electronic health record for the nurse and provider to assess and enter into their note. The provider places orders as needed, and the nursing staff follow up before discharge. Implementing a pre-visit fall risk screening would be beneficial for several reasons. It would reduce the workload of nursing and provider staff, streamline workflows, and can be implemented without drastically changing any staff member's workflow. However, this implementation may be complex due to issues with patient compliance or technology barriers. When patients do not complete this data before arrival, it can lead to incomplete and inconsistent information. And some patients may struggle with the digital format requiring a paper form, therefore increasing the workload of registration staff. In addition, these digital screening forms do not replace clinical judgment, and patients may require more in-person assessment. After evaluating potential solutions, I recommend implementing the fall risk screening into the nursing intake workflow. You may wonder why this is the best option. First, this implementation will not make a drastic workflow change for the nursing staff as they are already completing several intake forms and assessments. At this point, nurses can utilize screening and clinical assessments to document fall risk screening. It will ensure a structured, standardized documentation approach and minimize reliance on patient compliance. This approach gives less risk for potential errors when comparing it to a pre-visit screening form. Several measures can be taken to involve stakeholders in the implementation. First, comprehensive screening should be given for everybody involved in the fall risk screening implementation. This details how continuing education and training provide opportunities for nurses to continually improve their knowledge and skills, keeping up with latest developments in medical science, technology, and healthcare practice, and provides an opportunity for nurses to review their practices and ensure that they are providing evidence-based care. Education and training for nurses and providers can be online and in person, ensuring staff are adequately prepared and confident for the implementation. Next, there should be a streamlined, user-friendly process for screening that ensures workflow is optimized. A hard stop should be implemented into the electronic health record system to provide a message prompting for completion when nursing staff to attempt to place a note if the fall risk screening is not completed. In addition to tracking completion rates within the provider efficiency report, continuous feedback should be collected from all stakeholders to analyze impact and adjust as needed. This implementation will ensure that fall risk screening is being completed and in turn allows for early identification of patients who are at high risk for falls to take preventative action, improving patient safety. By implementing it into the nursing intake workflow, the nursing workflow will slightly shift, but minimally, as this is completed with other similar screenings and assessments. Regulatory compliance and ACO data quality standards can be obtained by achieving 100% compliance with the fall risk screening, minimizing adverse outcomes and avoiding penalties. In conclusion, it is essential to address the critical issue of fall risk screening not consistently being completed, which has impacted our compliance as an accountable care organization and increased risk for patient safety. The recommended solution to integrate fall risk screening into the nursing intake assessment meets compliance and safety measures By implementing comprehensive training, optimizing workflows, and obtaining continuous feedback from involved stakeholders, we can enhance the quality of care in our facility. Thank you all for taking the time to be here today. Through this implementation, we can drive success for the organization. If you have any additional questions, please get in touch with me via the slide on the email. And then here are the references. Thank you.